Well, hello, everybody. This is Tony Young. I'm the president of RISE San Diego. And I'd like to introduce, and first of all, thank you for coming onto this Zoom conference that we're going to have today. And it's going to focus on the COVID-19 and the impact on Black lives, specifically here in San Diego. And we appreciate that. We appreciate that you're here. And I'll just tell you a little bit about RISE. RISE is an organization that focuses on urban leadership. We do a lot of work with the University of San Diego and community leaders throughout the region to prepare them for issues just like this, what we have in front of us. We also prepare nonprofits to be able to serve the communities of the urban communities in San Diego. And finally, we're doing just what we say we are going to do when it comes to engaging the community on issues that are important to us. And so today we have a great panel. The panel is going to be led by Dr. Zachary Green, who's a professor of practice in leadership studies at the University of San Diego. The panelists will be Dr. Rodney Hood. Most of you know him as a community health advocate, but he's also a community leader, has been the chair of the Gang Prevention and Intervention Commission, and has provided a number of different studies on health in our community. Donna DeBerry is a brilliant individual, has done work all over the world. Her expertise is diversity and inclusion. She's also, it happens to be the president of the Black Chamber of Commerce here in San Diego. Natasha Ridley is a local artist, again, a brilliant woman who has done work throughout the community, specifically focusing on the arts. And she does a wonderful piece each year called MOSAICS. You get a chance to see it, I'm sure you'll be impressed. We'll have one this year too. And our good friend, Bishop William Benson, who among other things is the executive director for Pastors on Point, and has done amazing work throughout the region here in San Diego and abroad. So thank you all for being here, and we're excited to get to this, this discussion, and I'll pass it on to Dr. Green.
Thank you very much. I really look forward to the work that we're going to do in looking at the impact that the coronavirus has had on the African American community, and specifically focusing here on San Diego. One of the things that we like to do when we have these webinars at RISE is to have a poll to engage you right from the very beginning. So you will see that there's a poll question that's about to come up, and that'll give us some idea of where you think things are. So there it is. You can give your responses, and so we'll give you about a minute or so to scroll through the questions and let us know what you think. That's the feedback form. Let's try the other one. Thank you. There we go. So this is your community survey. In terms of your perceptions of the needs of the Black communities in San Diego, which of the following do you believe are most important to address? So we'll give you about a minute, and please indicate your responses. Okay, take another 30 seconds. Okay, we'll close the poll now, and let's see what our responses are. Okay, as you can see that one of the primary issues, there are actually two, are ensuring timely access to testing and healthcare for the virus, as well as monitoring seemingly disproportionate negative health outcomes related to the pandemic. That does not mean that the other issues are not important, but in terms of this particular group of you who are watching this webinar right now, those are the issues that you want us to address, and we will address those as well as others as we go forward. At this time, I would like each of the panelists to give us that sort of 1-minute view from their own perspective of really what's at issue in our Black communities as it relates to coronavirus. And we're going to start off with Bishop Benson. Bishop, what do you think from your perspective that really is at issue right now?
Thank you, Dr. Green. I believe that one of the main issues as being a leader of the faith community is how we were affected in our places of worship. Many people, especially African American, church is the grassroots and the foundation of how they were raised and what they believe. And contrary to popular belief, no matter how the behavior is, everyone knows that they can return back to their faith for refocusing, regrounding, and restructuring. And to be in a century where we've been absolutely removed from the building is unexplainable. Dealing with funerals, where this is the first time in my life that we haven't been able to be at the bedside with our loved ones and then have a traditional homegoing or funeral or wake. The faith community is mesmerized. We're traumatized, but we're making it through.
Okay, thank you very much. Because what you speak to is that things that in our lifetime have not been experienced, but in the faith community, you're feeling it very acutely. We also are feeling it very acutely in the arts community, and especially around generational dynamics. And Natasha Ridley, would you like to speak to how you see things right now?
Yeah, I think if anything, this virus has only magnified the issues that we were already facing in the arts community. And so when you think about funding, equity and inclusion in terms of ensuring that people of color as artists have access to proper funding, there's definitely less of that now. And then you also have to take into consideration, there are a lot of people who do this as a living. And so then what happens if we're not allowed to gather? What happens if we're not allowed to create events that help heal the community? There's a lot that goes into that. I also think from a mental health capacity.
Thank you very much. And Donna, DeBerry, there are views that you have not only in terms of the inclusion aspects of this, but there are also issues in terms of your role with the Black Chamber of Commerce that you're beginning to see. So why don't you give us the 1-minute version and we'll go deeper into that a little bit later.
Okay. So I will tell you that there is a unique vulnerability of our Black-owned businesses and neighborhoods that's been created by COVID-19. And we are seeing a disproportionate impact for our Black businesses as well as the health of our individuals. And what has happened for us is that there's a crisis put on top of a crisis that had already existed. And economically, we're just devastated, and we are suffering in a big way. There's a significant number of Black entrepreneurs that fall into specific categories of businesses, like restaurant stylists and barbers. And when you combine all of the closing and the loss of businesses and revenues for churches, those are our economic pillars for our community that's been devastated.
Okay, thank you very much. And we'll go more deeply into that a little bit later. And Dr. Hood, from your perspective, just give us an overview, because we're going to get much more deeply into the other issues around health disparity, but just give us an overall for right now. Dr. Hood.
You may be muted.
I think he is muted. Yes, Dr. Hood, you're muted. Thank you.
Okay. All righty. Sorry about that.
Yes,
Yeah.
sir.
Good evening. I'd like to start off by saying I've been studying health disparities for the past 30 years or so. And so when a catastrophe hits, it uncovers the disparities in a way that usually it should not be a surprise. When we had a catastrophe in Louisiana, New Orleans, Black folks suffered the most. During this pandemic, we're seeing the same thing. So, and that really has to do with the underlying chronic conditions that exist that causes disparities. We talk about comorbidities and pre-existing conditions of hypertension, diabetes, asthma, being overweight. All of these predispose anybody to their immune system to be more susceptible to this type of infection. But I think we talk about that, but nobody really talks about the reason why Blacks have more of those diseases. And I think it's really the precondition of structural racism. It's the precondition of racialized poverty. And at some point in time, we need to have a discussion about how we impact the latter.
Okay. I want to thank you very much for that introduction, because that's something I want all the panelists to speak to. But from an epidemiological perspective and from an overall health advocacy perspective, Dr. Hood, I'd like you to go more deeply in it. What are we seeing specifically in San Diego? And you cited Louisiana. We also know that there's similar statistics in Detroit, Milwaukee, any places where there's a concentration of African Americans. And now, as we're seeing in the South, as they begin to change the restrictions, but this is at the point where we're noticing that there's still an increase in infections and in deaths among African Americans. So can you speak to that? And then I would also want the other panelists to speak about what do you think is leading to this really disproportionate impact on our communities?
Yeah.
Okay, so Dr. Hood, please.
Yeah. So outside of California, when we look at the impact on Black folks, the numbers are frightening and more devastating when we look at the population of Blacks versus the rate of death and infection. When we look at Chicago, 30% population of African Americans, 72% deaths. We look at Milwaukee, about 42% population, about 50% deaths. I can go down to Louisiana. When we come here to San Diego, we only make up 6%, and I think the numbers still show disproportionality. The last numbers I saw were about 6% and account for 12% of the deaths in California. When we talk about who's getting infected and we look at it by race and ethnicity, African Americans are in the top 3. I think the Pacific Islanders are number 1, followed by Hispanic, Latino, followed by Black. Now, I think those are early numbers. One of the reasons is that I don't really think that the testing is adequate enough in the Black community to really pick up all the disease. And so I know part of the issues that the audience checked was testing, and I think that that's critical because I think in the testing that's taken place so far, we've been underrepresented.
Thank you. But I imagine the other members of the panel are also seeing the ways that this disproportionality is showing up. Okay, Natasha, Ridley, there's some ways that you were speaking about in terms of the artist community, but there are also ways that you spoke to this in terms of mental health and your perceptions there.
Yeah, just because there's a big movement within not just San Diego, but within the art community to really use art as a way to heal and as a way to have serious conversations, but using that and pairing it with the arts. And so what ends up happening is that there's no space for that anymore. And so how do you continue to create the same level of access to individuals? Because realistically, we're relying on everyone having internet, we're relying on everyone having, certain devices in order to be virtually connected to one another. And so then how do we continue to reach people if that wasn't really a way that they were interacting with individuals to begin with? And that's one of the things, even with MOSAICS, we have to constantly have the conversation around, well, what happens if people don't use social media? So then therefore we go to libraries and we have posters and flyers up. But then when you're in the middle of a pandemic, how do you reach people in that way?
Okay, thank you. And Bishop Benson, you already spoke to some of the underlying issues that we're running into in terms of faith communities, but also the realities that this has a disproportionate impact on the ways that we gather as a people. Would you like to speak to more of that, please?
Sure. We know that we have gained strength. For even the scripture, the Bible says that there is safety among counsel when we come together. And church has been that place when you're oppressed or burdened, that you would come and get that supernatural uplifting or just a fellowship with the brethren. I would like to echo what Ms. DeBerry said. You've put pressure on top of pressure. We have disparities on top of disparities. I don't even know if we have time to talk about, we just began to remove the stigma of mental health. And so the church is now trying to wrap its hands around the mental health community. And now we have to see about them as well. And so we're last to get all the information. We're last to get all the resources. And here we are with disparity on top of disparity, crisis on top of crisis. So this is just another layer of dysfunction that falls in our community.
Okay, thank you for that. Not thank you in the sense of what you said, because it really hurts as I hear you. I mean, there's a painfulness to this reality that I think we're all beginning to feel. And the fact that we are often last to receive even these morsels of information that save lives is a problem. And I know that Donna DeBerry, you were speaking to this. So could you just say more about the disparity and how it shows up, please?
Yeah, so, one of the things that I've always been talking about is this color blind that happens, where everything is, from an economic standpoint of how even money's distributed, there's such disparities around racial equity for our businesses. And, we walk around, and I've seen the city and the county, and when I was involved with Katrina, the same thing happened, is that they bring out this one size fits all for all businesses. And it doesn't operate that way. We have our own unique challenges and problems. And so when you try to create processes that we can't participate in, based on lots of things. As an example, I was looking at the SBA. I actually applied because I wanted to go through the process of the SBA, of the PPP.
Yes.
And the first, one of the questions was asking about, have you ever been convicted of a felony, or have you ever been, automatically that just takes us out of the equation for any type of loans. So starting to think about those kinds of things, and even for the city of San Diego and the county who actually have those questions when you want to apply for a grant, that, because they're going by, federal rules or guidelines, that automatically puts us at a disadvantage for many of our small Black and brown businesses that are in the communities.
So you're saying even before we get started, the first question on the payroll protection plan is already doing something that may exclude many small business owners. Even
the city grant, the EDD city grants, that is one of the questions. So for a person who has been convicted, but they've done their time, right? Whether it's a misdemeanor or a felony, but they've done their time, they've served, they now own a business, they're contributing back to society. They are at the worst disadvantage of all because of that one question.
Yes. So there's a question that's coming from one of the people who's watching the webinar about the impact on the people who are unsheltered at this moment, the people that are homeless. Bishop, I imagine that your community and your council of other ministers is trying to address those kinds of issues, as well as issues around literally like feeding people at this point. What are the kinds of things that you're seeing? You're on mute.
Dr. Green, that is a phenomenal question that our viewer asked us. In the old days, if you were called to be a pastor, as long as you preach between Genesis and Revelation, you was all right. In this day, you have to be a pastor, a social worker, a therapist, a daycare provider, a consultant, and we're already anywhere between 30 to 60% below in tithes and offering because we can't even meet. And a lot of the older givers are not on PayPal, Cash App, and those types of devices. So with the money that the church is getting, now we have over 6% of our congregants who have now filed unemployment. And now they're looking to the church to be the Vons, the Ralphs, and the grocery stores that they would normally shop at. And the church has to provide. We just have to do it. We cannot say no. And so now what the money they used to go to rent and bills is going for sanitizers, food, masks, because everyone knows when problem arises, they look to the church. That's the foundation of the community.
So you're saying you're down 30% in terms of tithes and offerings, but you know that there's a 6% bump in unemployment already. That's just right now. This is in the first 3-4 weeks. But people traditionally are going to turn to the church in these kinds of times. And so there's a need to provide, but this is really stretching. And plus your role now is also social worker in these kinds of situations. Am I hearing you correctly?
You nailed it right on the head, Dr. Green.
Okay, so I'm going to have to go back to you, Dr. Hood, because this disproportionality in terms of outcomes, in terms of health disparities, you're also talking about underlying structural issues. Could you outline some of those? Because maybe not everybody knows what some of those structural issues are.
Thank you. Yeah, when we talk about structural issues, really we're talking about social issues, talking about low income, poverty, or food deserts, lack of transportation, lack of education, lack of access to healthcare. Even if you have a job, sometimes you get a job, but you can't afford the healthcare. And I think all of these create inability to really access good quality health. What's also happening is that those structures cause the communities and folks within those communities to have a lot of stress. And in the medical community, we're now beginning to look at how stress causes disease, going all the way back to childhood. It's referred to as allostatic load. And that chronic stress physiologically attacks the body in a way over a period of time, increasing your blood pressure, kidney disease, diabetes, asthma. So, and that is not really measured very well. And so I think that's something that the Black community needs to become aware of, because when we go to a physician, we're giving him pills for his blood pressure and his diabetes, which he may or may not take, but we're really not dealing with the underlying issues that may be leading up to that. How can we decrease that stress?
Dr. Green, you're on mute.
Myself. Okay, in addition to those kinds of things around allostatic load, which really means we're carrying around this stress all the time, and it's in our bodies and leads to that. But Donna DeBerry, there's a thing that I've been learning about recently, which is called post-enslavement syndrome, stress syndrome, post-enslavement stress syndrome, which is like post-traumatic stress. And it seems to speak to that there are things that are by the nature of being Black people that we run into. So Donna DeBerry, is that something you can speak to, please? And you're on mute. You're on mute.
I can speak to it from this standpoint.
Yes.
I was reading an article just about what you said about how that shows up generationally.
Yes.
So that's the thing. So if you think about generationally, if you've lived in poverty, and even if you haven't always lived, and so let's say the next generation gets out of poverty, the stress that happened to that first generation just it just keeps going to the next generation because they feel like they absolutely have to make it. They have to be better than the last generation.
Right.
And that just keeps going forward on and on and on. The challenge is that systemically, the way that we live in the United States, many things have not changed generationally. We're still surviving. We're still not in a situation where we are economically advancing at the way that we should be advancing as a community as a whole. So constantly stress, if I think about when I was in human resources, and the minute that a Black person, we would have a Black person at an executive level, that stress of being an executive and being able to perform all the time, and the biases, the conscious and unconscious biases that happen in the workplace around people of color, it's just stressful enough being in the workplace. And so you think about owning your own business. What is that like when you have customers who are very different than you and you have to adapt? We're always adapting, and that's stressful. We have to, change and shift of who we are depending on who we're around, and articulate things so different. That's stressful. So yes, that post-stress generationally at all levels exists.
So that's there. And so I know that Natasha Ridley, you've been working on these generational dynamics. You're a leadership scholar in addition to being an artist. What are the kinds of things that you're seeing in terms of the generational issues that the virus is exposing right now?
I think I think Bishop named some of them. So there's the technology piece around, not having PayPal or Venmo or all of these other ways to pay for things. And even if I think about going to the grocery store, they really encourage a touchless form of payment. And I know my mom would rather use cash, right? And that's like the thing that they would prefer you not do. And so I think the challenge is how do we try new things and continue to move forward and know that something new and different isn't a bad thing, and that whatever was done in the past a lot of times was done to cope with something. So really great example is there was a woman who was showing her daughter how to make something. And she's like, we're going to cut the ends off of this and put it in the pan. And the daughter asked her, well, why do we do that? And she's like, I don't know. That's just how grandma did it. So that's how we make it. So they asked the grandmother, why do we do this? And she's like, oh, because I didn't have a pan that was large enough. And so I cut the ends off so that it fits. But that whole time, they never asked why. And they just continued to do it. So I think for us right now, we have to really think about why do we do the things that we do.
Well, you're each raising something that's really powerful, because I think a lot of people are beginning to say that there's going to be the post-pandemic. This is like one of those defining moments in human history for this generation. And it will be, what did you do before and what did you do after? So we're going to ask those of you who are watching right now their thoughts, questions that you have, and you can go to the chat function and you can begin to put those things in, and we'll begin to attend to those as we begin to also do this final round of questions from me to the panelists. And then we also want to hear from you and what it is that you want to offer here. So I was working with a group of Black folks in the academic spaces. And they came up with this list of online access in terms of education, food insecurity, disproportionate healthcare outcomes, of course, mental health and domestic violence issues that are arising, disproportionate placement of essential workers, meaning that more of us are these essential workers who are the laborers who are constantly being exposed to the virus, access to medical facilities And then there was an article just yesterday in the New York Times about rationing of ventilators and the decisions that doctors seem to be making around that, which may also have a racial impact of it. The policies in the southern states around the reduction of the restrictions and the complexities of prisoner release in terms of mass incarceration. So some of those are among the issues that we began to talk about today. I'm going to ask you again, Dr. Hood, of that list of things, do you see that there's a sort of an advocacy point that we need to attend to? Is there some place of advocacy that we as African-American people need to begin to address right now?
The answer is yes, and I don't know where to begin. Let me begin with your discussion about the discussion of who gets on a ventilator and who doesn't.
Yes.
During the pandemic, they're anticipating what took place in other countries, China and Italy, where they didn't have enough ventilators. They had 10 people that needed them, but only 5 ventilators. They had to make decisions. And so they came up with criteria. The problem is that the folks that are usually doing it aren't doing it from an equity lens. They're doing it from, they think it's fair, they think it's equal. But fair and equal is what keeps Black folks where they are. We need to impose the equity principle where it's about need rather than being equal. If indeed they come up with those criteria, my concern is that Black folks are already going to be down on the list because they're talking about, well, all this being equal, this one has a better chance of surviving, therefore we're going to put them on the ventilator. Well, we already said that white folks are healthy. So we need to be involved in that type of policy making. Number 2, testing. I think moving forward, testing is going to be critical for us to mobilize out of where we are now back to work in a safe environment. The testing is not focused on our community, okay? So we need to do not only testing for the virus, but testing for the antibodies so we can begin to know which ones in the community need to be isolated, which ones it's safe to go back. And I think if you don't have enough tests, then you apply the equity principle where you look at the data that I saw earlier. In San Diego, the problem is in the southern portion of the county,
Yes.
where Chula Vista, National City, and Southeast San Diego have some of the higher rates. If you look at it by race, Blacks are 3rd in line, but I think as they do more testing, you're going to see that move up. And so when you see that data, that's where the testing and that's where the resources should be. So we should be at the county, we should be at the state saying we need to make sure that our communities are getting tested like they should. And then the last is treatment. If you do get it, who's going to have access to treatment? Many folks lost their job, no insurance. Many folks are homeless, no insurance. So how do they get access? And disproportionately, there are a lot of Black and brown folks. So I think there are a lot of policy issues that we should be on top of. And I think number 1 is the whole ethical issues when they start determining who lives and who dies. And number 3, who has access to the testing.
Thank you very much for that, because what you spoke to, and it's one of the questions that we're having here, is that early on, Dr. Hood, you spoke to some of the factors that were leading to the disproportionate outcomes for African Americans. And you said that there are many structural issues, but you just outlined some others. Bishop, I'm also going to ask you the same question in terms of advocacy. And then I'm going to also ask the panelists to begin to address another question that's arising, is that we have children who are seeing all of this. And then the question is, how do we begin to speak to our children about the impact that this has? But first, Bishop, advocacy. What are the steps of advocacy that you see?
Well, the panelists that you have here is remarkable, all hitting on all the points. But if I could go back to the question and the comment that Mr. Berry had about the SBA. My concern is that we lead high numbers in the major disparities. And as Dr. Hood says, if we are leading in all of the negative disparities, how can you create a formula and call it equal? You can't do equal if we're the ones leading in the negative disparities. And so therefore we're eliminated from the funding, we're eliminated from the education, we're eliminated from all of the resources that will at least get us to go from ground zero to get at a place of even. We're not even at a place of even. So how can you come up with an even tool that automatically eliminates us because we're leading in the negative disparities? So it's like Dr. Hood said, it's time for us to look at policies. And when we run into these catastrophes, that we look at the need and not look at what's an even bar, a set of bar, because this is not a cookie cutter. This is not one size fit all. When you already know that we're already coming from a negative point from ground zero in order to meet those requirements. But it seems like we're automatically eliminated when it's time for us to even get to the bar.
And Donna DeBerry, that's exactly the point that you were making previously, wasn't it?
Yes, thank you. You know, if we're going to, we have to, let me start over. We have to approach this recovery differently than we ever have before. And it has to be around this racial equity framework, because without that, we're going to still be left behind, and we need to demand that. So at you were talking about, I love what both of you said, Reverend and Dr. Green, is the fact around making sure that this approach around, well, I was saying it first, was about we need to stop with this color blind and this one size fits all. That's what you were saying, the one size fits all approach around this pandemic, because really we need to be color bold. We need to demand that everything that we do is based, all resources that are distributed in the Black community needs to be based on racial equity. It has to be, or else we'll never get out of this crisis. So
well, color bold, I want to highlight that. Yes, that really means that, that is beautiful, because it really has to come from this equity lens. And equal isn't going to work, like the bishop is saying, and Dr. Hood is saying that look, once we do all of these things, we are already showing that these are disproportionate outcomes. So color bold, I wrote that down. That's beautiful.
Dr. Green, I want to jump in there and just let you know that, yeah, the way it happens at the policy level.
Yes, I want to talk about.
You have to remember that they want folks that are not in this position that I think the bishop clearly described. They want stuff too, right? And they are good at advocating for stuff too. And so the formula, they're going to start off by creating like this equal formula. I'm talking about the policymakers, without really recognizing what has happened, what is happening here in this discussion. And so Donna is absolutely right. And we were just on a phone call earlier, Donna, to talk about how we're going to, as a group, go to City Hall, the county, the state, our state delegations to advocate for something that actually deals with the issue.
Yeah, this is Dr. Hood, if I may. I think that the argument is the equity argument and not Black or what, because if you look at the data, Blacks are usually at the bottom or the top, and whatever it is usually not good. The folks that make policy understand equity, but they act like they don't when we use the argument. I think a good example is Governor Cuomo. He made an excellent equity argument for New York. We're getting it the worst. We need more ventilators. Focus on us first. Give us as many as we need. When we get healthy and well, then we'll start going back. So if you don't have enough, you focus on where the problem is. How do you know that? You look at the data. When you look at the data, the resources should be focused on us, bring us up to equal, then we can all be treated equal.
Okay, so Natasha, I'm going to ask you to answer an impossible question. So what about the homeless? What about the children? What about the prisoners? What about vulnerable populations? What's the advocacy that we need in those places?
I mean, I think it's challenging because if we're talking about equity already,
Yes, we are.
let's think about all of these different populations, but as people of color, because they're even more at a disadvantage than anyone else. And so I think as a community pushing forward, it really comes down to advocating. And when I say advocating, I mean be involved in as many things as you can be involved in that are different than the community that you're a part of, because you learn about how the system actually works. So like I had the opportunity of being a grant reader for nonprofits who receive funding from the city. And their focus is leaning towards equity and inclusion for the first time. But when you're looking at the criteria and you're looking at what's been considered acceptable, you see that equity and inclusion is not there. And so being in the room and in that space and being able to say, I'm going to score you lower because this is not equitable. And so I think as a community, we really have to start looking at how do we infiltrate the system itself. I think sometimes we try to do it on our own. And unfortunately, you kind of got to get in there a little bit and ruffle some feathers. So that's my opinion.
So then I'm going to turn another impossible question to the bishop. There's one of the people that is in the chat that is saying, what happens with the fact that testing has not been good for Black people in the past, that there have been times when we've been tested on. And so why should I be testing a system of oppression that has proven in the past that they do not have my interest, especially in terms of medical issues? But I want the bishop to answer that first before I turn it to Dr. Hood.
Well, I was going to mention Dr. Hood. I had the privilege of working with Dr. Hood for about 3 or 4 years, working with the Center of Disease Control on blood pressure checks for African Americans. And the disparity there was just the fear of the unknown. We learned that we had a fear of physicians during the AIDS epidemic. They brought mobiles in, and some of the fears of the physician was the physician treating us like a number, not communicating with us, and their bedside manner sometimes was so horrific that the people don't believe in the doctors. That they tell them all the way, you got high blood pressure, you got diabetes. I mean, there's and the medication, you're not even asking what is their body makeup to make sure that the medication is good for them. A lot of the medication that they were getting was never even tested on African Americans. It was tested on Caucasians, but saying, well, this worked for John, maybe it'll work for Billy. And so in some cases, most of our people have gotten more side effects from medication than actually becoming healthy. So like you said, Dr. Green, that was one of those hard questions. We have a stigma among our people that comes with a fear, not just with the testing, it's the fear. And for those who worked on the nonprofit side, they would come in and they would take these tests, and then they would take our numbers and get a grant and give it to someone else. And so therefore they got money from our negative disparities, but that money never came back to the communities where the disparities were, nor did they give the grassroots organizations the opportunity to be the contractors of those issues. And if I could say this, one of the things that Dr. Hood was very instrumental in is allowing the churches to come, because in most cases, the county were spending a lot of money trying to get the people to come to them. And we were able to tell them, we spend no money. And these people come to church 2 or 3 times a week on their own. Why don't you use the avenues that already exist in the communities that draw crowds and allow us, the ones who baptize them, the ones who marry them, the ones who go to their graduations, we have relationship with them, and therefore we would be able to give them more of an assurance that whatever the results are, they stay with us.
What I love about this panel is as we've gotten deeper into the conversation, the energy has risen around these issues. And I really like hearing that. Dr. Hood, I'm going to give you a word, and then we're going to I'm waiting to see if there are any further questions, and then we're going to give each of you your final 2 minutes. Okay, so Dr. Hood.
Okay, well, thank you, Bishop, for that. And you should know that we physicians as well learn from the churches and the folks going to the churches to actually be better physicians. But let me raise an issue that I think is of a concern. Because of the whole legacy, and we talked about post-traumatic slavery disorder and syndrome, that comes with a lot of distrust, that comes with a lot of negative feelings towards many fields, but especially the health field. Now, I've been practicing for 40 years. The majority of my patients are African American. I'm concerned that that survival mode is preventing us from getting to the thriving mode.
Yes.
I have hypertension, elevated cholesterol. I take my medication. I check my blood pressure. Many times I'm talking with an African American patient, and he said, "Well, I don't trust that medication." I said, "Well, I'm taking it." He said, "Doc, I trust you.
Yes.
But I don't trust what's in that bottle." I don't have an argument for that. Okay, but here's the concern. One of the reasons why we're at such risk is that we have hypertension, we have diabetes, we have cholesterol. We're not leading the most healthy lifestyles. And therefore,
Right.
When I compare African Americans to other populations, those diseases are not being as well controlled. That sets you up for disease. Here's the other issue. It is predicted this virus is in the community. It isn't going anywhere.
Not going anywhere.
Yeah, it's going to pop up again. And the concern is, and I just heard him say it for the first time, but in the medical community, we've already been talking about it, there's a very good chance this virus is not going to go away. It may pop up again in the fall at the same time the flu.
Yes.
Okay? And so the lowest vaccination rates in the country are with African Americans, especially when it comes time for the flu. And maybe about 60,000 people lose their lives each year with the flu. If both of these viruses come along, if you don't have a flu shot, it is now being shown that people are dying with the flu and the COVID virus.
Yes.
It is believed that the flu hits first, weakens their immune system, which they would probably survive from. Then the COVID virus comes on top of that. So, Bishop, one of the conversations I wanted to have with the faith community is we need to start having a dialogue that when this comes, I've been taking the flu shot for the past 40 years. I understand all the arguments. I understand I got patients that never want to take it. But I think it's going to be critical for us to at least start having that dialogue in our community, because I think especially this year, it's going to be important that African Americans try to get as much protection as possible. And the other thing is, we don't like to take pills. If they came up with a pill that treated it, many of us wouldn't want to take it. So those are some internal things that I think we need to begin to have a dialogue about.
So there are some internal aspects of how we as a people tend to respond to these dynamics that we're also going to have to address, and it requires the kind of conversation that we're having right now to recognize our own responsibility in terms of these issues, in addition to the systemic and structural pieces.
Yeah.
Now, there are a couple things here. Now, I have one person that's saying, well, okay, you talk about trusting doctors, but the French doctors are already talking about, yes, let's test the vaccine, but let's test it on Africans first, and let's see how it works there. And so this is the kind of stuff that is beginning to happen that really creates this hypervigilance about what this is. Now, we could go on now, and now what's beginning to happen is the chat is heating up. So everybody's getting all engaged now. But each of you, your 1 minute. Okay, so you need to come up with a way that we're going to deal with this. You can't just say, well, you know, something general. You have to come up with something specific and concrete for us to address this pandemic in terms of the African-American community. Who's got their word? Who's ready to go first? Donna, you look like you're ready. So go ahead, Donna.
Of course. So I want you to think really quick about the mission of the chamber. So the mission of the Black Chamber of Commerce is to create generational wealth through education, through supporting businesses, all of those things, right?
Right.
And how we are going to, you know, we really need to create our own economic stimulus. This is the one time I can't even think in history that we have the opportunity to do that. This next stimulus package that's coming down the pipeline is going to be open to those the Black barber shops and the beauty shops. How we shape the narrative and leverage that money is going to shape our future generations of our children and of us right now.
Okay, well, I want to hear about that happening in Donna DeBerry.
No, but it's true. And we need to collaborate. This is the churches, everything. We all need to talk about how are we going to conduct business from this forward on? How are we going to open our business? How are we going to rebuild our businesses in our community? And if we don't have that conversation now, it's going to be another Katrina, which the money comes and it goes and we're still in the same situation.
Well, you did not go, well, you went, thank you for saying the reality. Okay, because that's right. We could just repeat this again. Okay, who's next? Natasha Ridley, you look like you're ready. What's your final word? And what concretely, specifically, what do we need to do?
I think that we need to be informed. I think we need to have intergenerational conversations around, you know, why we do some of the things that we're doing now and how can we kind of push some new things forward. And then think about structure. What is it that you are unhappy with now that needs to be in place before this pandemic hits again? So I think between staying informed, having conversations with one another, and creating an agenda and then going after it, I think that we can kind of set ourselves up for being more prepared, because that's really what it's about, being more prepared.
So identify what it is that we have as issues now, and then also make sure that we're prepared going forward. Am I understanding that? Okay.
Yes.
Dr. Hood, okay, what do we need to do?
So I agree with what was said, but if how are we gonna reopen our businesses? To me, testing and tracing in our communities is gonna be key. That will help you make that transition in a safe way. And we should, at a policy level, make sure that the testing opportunities come our way in an equity way, so that we can prepare for that. If you don't do that now, that won't happen. The other is treatment. We also need to make sure that whatever treatments are available, whether we have insurance or don't have insurance, we have access to the treatment. I think the third is what I call a trusted messenger. So all of these trust issues we're talking about, Bishop, I'd like to have a conversation further with you about this, is how do we in a community start having trusted messengers, that's ministers, physicians, other leaders, going around to groups, talking to not only how to protect themselves during this period of time, but when various therapies come up, what's good about it, what's bad about it, so that we can maximize the African-American community to, I think, take vaccines if it's appropriate, take medications if it's appropriate. So,
thank you. Okay, really appreciate that, Dr. Hood. And Bishop, you get call to action, but also the benediction before we turn it over to Tony Young.
Thank you, Dr. Green. I think that as I was listening, I see how important it is for the faith-based community to join up with the arts, to join up with the physician, and to join with the Black Chamber, because all of those are intricate part in how the church expressed themselves. And the sad thing out of this, the first thing that happened is our kids were taken out of school with no explanation, and they've been home for the last month and really don't even know what hit them. And that is, the millennials are the social bugs of our generation. And for them to have, I could see another level of anger with them if we don't bring them in on the conversation. If we don't have this relationship with the physicians, the church is in a position to expire, because without the community, without jobs, without help, we have no congregation. So I think the main thing that we want to do is to have this dialogue and figure out how can we expose first to trust and healthy eating, blood pressure check, find out the existing ailments now, so we'll be able to talk about this. And I also believe if we don't come together financially now and look at class action funding, we're going to miss this great opportunity to not be devastated by the crisis behind this epidemic.
Thank you very much. And so Tony Young, you get the last 30 seconds.
I can probably do it in less than 30 seconds, but what I would say is that thank you, Dr. Green, for moderating this. You're amazing in regards to how you bring out these issues from our panelists, and you've done this before, and we appreciate that. I take a little bit of credit for identifying some of these great panelists. They're all my friends, and I really like them a lot. And to me, this is really what leadership is, and that's what we saw tonight. RISE is going to continue to have these types of events. Every Thursday, we will have a discussion on something related, in this case, the COVID-19. And, we're going to get through this together, and we're going to continue to be around to support this dialogue. So thank you all for being here. We appreciate it. And please stay safe and have a wonderful evening.
And thank you all. And there's going to be a pop-up survey about how you like this or not. And thank you, panelists. This was my favorite one so far. I really appreciate your work. Thank you so much. All right.
God bless you all.
Okay, bless you
stay
all.
safe and stay sanitized.
Bye now.
Thank you.
Thank you.
Good enough, Tony Young?
That was excellent.
Yeah, this one was okay. This one's definitely okay.
Yeah.